This video is for informational purposes only and is not a substitute for professional medical advice. Always consult a healthcare professional for any health-related concerns. I don't think people understand the complexities of bipolar disorder. Bipolar disorder, also known as manic depressive illness, is a chronic mental health condition characterized by extreme fluctuations in mood, energy, activity levels, and the ability to carry out daily tasks. These mood changes range from manic or hypomanic episodes to depressive episodes and can significantly impact a person's life. Scenarios.
I often experience periods of intense creativity and productivity, where I work on multiple projects, get by with little sleep, and feel euphoric about my accomplishments. During these times, I take on extra freelance work, believing I can handle it all. However, these bursts are followed by periods where I become overwhelmed with fatigue, struggle to meet deadlines, and feel deeply depressed and unmotivated. I withdraw from social activities and lose interest in my work. My mood swings strain my relationships and professional life.
After several cycles of highs and lows, Lisa consults a psychiatrist who diagnoses her with bipolar II disorder. She begins a treatment plan that includes mood stabilizers and cognitive behavioral therapy, or CBT.
Your therapist will help you recognize the early signs of hypomania and depression, allowing you to adjust your workload and seek support before your symptoms escalate.
Over time, Lisa learns to balance her creative energy with rest, significantly improving her work-life balance and emotional well-being.
During one semester, I experience a manic episode where I feel invincible, sleep only a few hours each night, and engage in risky behaviors such as excessive partying and impulsive spending. I decide to invest my tuition money into a new business idea, convinced it will succeed. My grandiosity leads me to neglect my studies, resulting in failing grades. When my manic episode subsides, I crash into a deep depression. I become overwhelmed with guilt and despair over my actions and poor academic performance. I isolate myself, have trouble getting out of bed, and contemplate dropping out of college.
Michael, you really should seek help. We're all worried about you.
Concerned friends encourage Michael to seek help. A mental health professional diagnoses him with bipolar I disorder.
Michael, your treatment plan will include medication to stabilize your mood and psychotherapy to address your impulsive behavior and depressive symptoms. You'll also learn stress management techniques and the importance of regular sleep patterns.
With ongoing support, Michael starts to regain control over his life and academic goals.
I've experienced mood fluctuations for as long as I can remember. Sometimes I have periods of increased energy and mild euphoria, and then I feel low and tired. But the changes aren't as extreme as in full-blown mania or depression.
These subtle shifts have made it difficult for Sarah to recognize a pattern, and she attributes them to the stresses of daily life and hormonal changes. Over the years, her mood swings begin to interfere with her teaching and relationships.
During my high-energy periods, I overcommit to projects and social events, only to cancel them when I feel too low. It's so frustrating, not being able to maintain consistency in my professional and personal life.
Finally, Sarah discusses her symptoms with her doctor, who refers her to a psychiatrist. After a thorough evaluation, she is diagnosed with cyclothymic disorder.
Your symptoms suggest cyclothymic disorder. We'll work on a treatment plan that includes medication and therapy, focusing on identifying mood patterns and developing coping strategies.
Sarah also engages in lifestyle changes, such as regular exercise and mindfulness practices. By understanding her condition and implementing her treatment plan, she finds more stability and satisfaction in her teaching and personal relationships. Bipolar I disorder involves at least one manic episode that lasts for at least 7 days, or is so severe that immediate hospital care is needed. Depressive episodes are common but not necessary for diagnosis. Symptoms of manic episodes include elevated mood, grandiosity, decreased need for sleep, talkativeness, racing thoughts, and risky behavior. Depressive episodes involve profound sadness, hopelessness, loss of interest in activities, and physical symptoms such as changes in sleep or appetite. Bipolar 2. Disorder is characterized by at least one hypomanic episode and one major depressive episode. The hypomanic episodes are less severe than the manic episodes of bipolar 1 and do not include psychosis. Symptoms of hypomanic episodes include elevated mood, increased activity or energy, decreased need for sleep, and heightened creativity or productivity. Depressive episodes are similar to those in bipolar 1, but often more chronic and disabling. Cyclothymic disorder, or cyclothymia, involves numerous periods of hypomanic symptoms and depressive symptoms lasting for at least 2 years, or 1 year for children and adolescents. The symptoms do not meet the criteria for a full hypomanic episode or major depressive episode. Symptoms are milder but chronic mood swings with less severe highs and lows. Other specified and unspecified bipolar and related disorders include bipolar disorder symptoms that do not fit the categories above, but still cause significant distress or impairment. Manic episodes include elevated or irritable mood, where a person feels excessively happy, energetic, or extremely irritable. There's increased activity or energy, with hyperactivity and increased goal-directed behavior. Racing thoughts lead to a rapid flow of ideas, making it difficult to focus on one task. A decreased need for sleep means feeling rested after just a few hours. Grandiosity involves an inflated self-esteem or unrealistic sense of superiority. Impulsivity often leads to risky behaviors such as spending sprees, unwise investments, or sexual indiscretions. Hypomanic episodes are similar to manic episodes but are less severe and do not cause significant impairment or require hospitalization. Depressive episodes include a low mood or sadness with a persistent feeling of sadness or emptiness. There's a loss of interest or pleasure in activities that were once enjoyable. Sleep disturbances can manifest as insomnia or hypersomnia. Fatigue is common, with a persistent lack of energy or feeling tired. Feelings of worthlessness or guilt involve overwhelming feelings of self-blame or inadequacy. Cognitive impairments include difficulty concentrating, making decisions, or remembering things. Changes in appetite or weight can result in significant weight loss or gain. Suicidal thoughts or behaviors involve recurrent thoughts of death or planning for suicide. Causes and risk factors. The precise causes of bipolar disorder are not fully understood, but it is believed to result from a combination of genetic, neurobiological, and environmental factors. Genetic factors. Bipolar disorder is more common in individuals with a family history of the disorder. Studies indicate a complex interplay of multiple genes rather than a single gene causing the disorder. Brain structure and functioning. Imaging studies suggest differences in the brains of people with bipolar disorder, particularly in areas related to mood regulation. Neurotransmitter imbalances involving chemicals like dopamine, serotonin, and norepinephrine may contribute to mood swings. Environmental factors. Stressful life events, trauma, or major life changes can trigger the onset of episodes. Substance abuse or medical conditions like thyroid problems can also contribute. Biological factors. Hormonal imbalances and biological clock disruptions, such as those affecting sleep-wake cycles, may influence mood episodes. Diagnosing bipolar disorder involves a comprehensive evaluation by a mental health professional and typically includes clinical interview, detailed questioning about mood swings, behavior, and family history, physical examination, to rule out other medical conditions that may cause mood symptoms, psychiatric assessment, structured questionnaires and mood charts to document mood patterns, diagnostic criteria, based on the DSM-5 criteria, which outlines specific symptoms and their duration. Bipolar disorder is a lifelong condition, but effective treatment can help manage symptoms and improve quality of life. Treatment typically includes a combination of medication, psychotherapy, and lifestyle adjustments. Medications. Mood stabilizers, such as lithium and anticonvulsants, help control mood swings. Antipsychotics are used to treat severe manic or mixed episodes. Antidepressants are often prescribed for depressive episodes, sometimes in combination with a mood stabilizer to prevent triggering mania. Benzodiazepines are used short-term for agitation or anxiety. Psychotherapy, cognitive behavioral therapy, or CBT, helps manage negative thought patterns and behaviors. Interpersonal and social rhythm therapy, or IPSRT, focuses on stabilizing daily routines and sleep patterns. Family-focused therapy educates family members and improves communication and support within the family. Lifestyle and self-care. Routine is key, maintaining regular sleep, eating, and activity schedules. Stress management techniques such as mindfulness, meditation, or yoga can be beneficial. Substance avoidance is important, avoiding alcohol and recreational drugs which can trigger episodes. Support systems like engaging with support groups and building a strong network of friends and family are crucial. Finally, ongoing education about the disorder helps individuals understand their symptoms and treatment. Living with bipolar disorder involves ongoing attention to treatment, lifestyle, and support. Here are some key aspects. Medication adherence. Taking prescribed medications consistently and communicating with healthcare providers about side effects or concerns. Therapy engagement. Regular sessions with a therapist or counselor to address emotional and cognitive challenges. Lifestyle maintenance. Consistent routines, healthy diet, exercise, and stress management techniques. Monitoring symptoms. Keeping track of mood changes and identifying triggers or warning signs of episodes. Building a support network, involving family, friends, and support groups in treatment and providing education about the disorder. Bipolar disorder is a complex mental health condition that can significantly impact an individual's life. But with appropriate treatment and support, many people with bipolar disorder lead fulfilling and productive lives. Understanding the symptoms, engaging in consistent treatment, and building a robust support system are essential for effective management. If you suspect you or someone you know may have bipolar disorder, seek professional help to obtain an accurate diagnosis and appropriate care. What are your thoughts on this topic? Share your opinions and let's dive into a discussion in the comments below. Thanks for watching. If you enjoyed this video, make sure to like and subscribe to our channel. And hit the notification bell so you never miss out on our latest uploads.